Hey, folks, and welcome to a very, very special and wonderful video documentary from A Plain Truth to and Well Healed. I have the great privilege of honor to be with Dr. Ingrid. Dr. Ingrid has joined me in New Jersey a few weeks ago, where we had the privilege to be have a Beyond Biomagnetic training seminar from Dr. Luis Garcia on biomagnetic healing. This is an ancient practice, been used by the Chinese, been used by the Egyptians, and has been buried by the medical associations up until recently, where more and more are discovering that using universal energy healing is a wonderful, wonderful, wonderful treatment to improve and restore us to homeostasis balance, where cellular structure is rebuilt and funguses, viruses, parasites cannot live. So here I have on the line Dr. Ingrid from Spokane, Washington, where she is beginning to do self-healing in support of biomagnetic therapy. She's having incredible results using what she learned from Dr. Garcia, and she's here to help share her story with us and also invite anybody in the Washington, Idaho, Oregon that can come and meet her in Spokane, where she's offering discounted sessions to do biomagnetics with her. Welcome, Ingrid, Dr. Ingrid. It's great to have you on here.
Thank you, Jamie. That was a very nice introduction. Thank you so much.
What is your background, Ingrid? Dr. Ingrid, where did your doctor come from?
So the doctor term. Well, I have a doctorate in philosophy in microbiology, so a PhD in microbiology, molecular biology, and biochemistry, with an emphasis, if I didn't have enough words up above, with an emphasis in the cell biology of pathogenesis. So in a nutshell, I studied the living organisms that you would find under a microscope. My PhD focus was on a parasite called Toxoplasma gondii, and the emphasis component of that degree, the cell biology of pathogenesis, is really just studying how different organisms can cause disease in a living host. That would be you and me.
And weren't you a professor for a while too?
Yes, I was the lead organic chemistry instructor, and I also taught microbiology, nutrition, introductory foods, and carbon compounds, which was also referred to as baby organic chemistry, for dietetics, those types of programs where you didn't need the bona fide, very difficult organic chemistry, which is oftentimes referred to as the weed out course to getting into medical school. So a lot of our students that would take my courses, a number of them, if they weren't already pre-nursing or pre-med, a lot of them oftentimes already had a degree, say in geology, and they were coming back because they wanted to take the prerequisite courses in order to prepare and be able to pass the MCATs for getting into medical school.
Wonderful. And then how did you find out about biomagnetism?
I actually first heard about biomagnetism, about 18 months ago, a while ago, and I actually was one of those people who, in one ear and out the other ear, I heard about it from my stepmom, of all people, just because she knew about my lymphoma journey. I had to medically retire in 2014 from full-time teaching. Well, I retired completely at that time because I was diagnosed with T-cell lymphoma. And I just actually returned to teaching by invitation, which was very exciting, last year. And I just taught a microbiology lab once a week, which was so wonderful for me, emotionally, mentally, with my purpose being back in a classroom.
Right.
So that was very exciting. But so in my own personal journey as a lymphoma patient, I had tried what Western allopathic medicine could offer, because that's the background that I came from. Those were my folks. And then when that failed, tried nutrients, phytonutrients, and all of the other type of holistic options out there. And so my stepmom had introduced me to biomagnetism, just mentioning it via an email. But I didn't really take it seriously until I learned about it actually through you, Jamie. So thank you so much.
No, thank you. And you and I got connected through going into the darkness of the world, the toxic world today, and you were looking into a lot of the medical issues of allopathic, and it wasn't quite resonating. Tell me if I'm wrong here, but wasn't resonating with what you were finding out as far as the deeper research and vaccines and other pathogens that were causing possibly some of the issues we have today. And then you came down and visited us, and the healer we were working with was showing us how this biomagnetism worked. And then you went back to Spokane. And then what happened after you went back to Spokane?
Right. Okay. So, well, if I just could backtrack just a touch. So when I came in and saw you and met your think tank group and that wonderful healer, I was very open-minded because at this point, when you've been, for lack of better words, a biomedical tortured patient for 5 years or 4 years, your eyes are open to see and your ears are open to listen to what might be around. Mm-hmm. So I came in with a very open mind when I first met the healer, which I think is really important. And I was shocked because the first places that he put the magnets, and I assisted with that, was on my knee and behind my neck, head, just below the occipital lobe area. And I had been struggling with chronic knee problems since ballet in high school, and the back of my neck since neck surgery last year. And I didn't tell the healer anything about myself. He energetically knew to put the magnets there. And what's amazing is I haven't had a single issue with my knee or that area of my neck since then. And that's amazing. So my firsthand experience was just blown away with it working on my own body. And then when I returned from seeing you guys down there and back to Spokane, I was dead set that there's something here I needed to study. And so I started looking through what was out there in the literature regarding like PubMed peer-reviewed articles. I'm a classically trained scientist, and so I go about looking at things where I need to see the controls and the evidence. And I found Dr. Luis Garcia online and his training and the testimonials from his course. And I also looked into his medical background, and I knew hands down that was the course for me. And then you guys ended up showing up, so it was just meant to be.
Yeah, I did the same thing. As I said, well, we gotta learn this practice because there's only one healer I know that's doing this who trained under Dr. Goyes, and Dr. Garcia spent something like 20 seminars learning from Dr. Goyes himself, and then he's come from Colombia to the United States to New Jersey, and he quit. He's got a great story about quitting his medical practice to practice, not practice, but to heal using biomagnetism, and his father, who paid for his medical schooling, who was a medical doctor himself, pretty much disowned Dr. Garcia because he thought it was crazy to quit Western medicine to do this biomagnetic, beyond biomagnetic healing. And he has 11 years, and he's taken it to a whole nother level. Dr. Goyes introduced it to us, and now Dr. Luis Garcia has taken it, and he is just, I mean, the class was phenomenal. We had 5 days in New Jersey. You and I were sitting next to each other, and we just kept hitting each other's shoulder going, isn't this the coolest thing ever, right? And
I
we
know,
just,
right?
yeah, and you were,
What was great for me about the class was that I already came in with obviously over 20 plus years of biomedical research expertise. In the last 12 months, I had been working with, a friend of a friend has been forwarded my phone number because the ear, nose, and throat doctor doesn't know what to do with her, and she's up a creek and she needs help. Can you help her understand what her labs are? Help her talk to her doctor and formulate good questions, that kind of thing. And so for me, being able to sit in the class with you, and it was a whole week intensive. I mean, 12 hours a day, all we were immersed in was the bioenergetic learning of how do you do muscle testing and the biomagnetics, excuse me. But I got to sit back and really enjoy and soak up all the theory and application because I already came in with such a background in the pathogenesis so the pathogens, how the quantum interference, which is basically the quantum mechanics that explains how this energetic work occurs. I taught that before, but from a very chemistry standpoint.
Right.
So I got to sit in class and just apply all that background knowledge to what Dr. Garcia was telling us. And I was just a sponge. So since I've returned, I've worked every day nonstop, just helping people that I know, my pilot clients or pilot friends, giving them sessions. And I'm seeing results with every single person I have worked with.
Well, let's get into that in a minute. But first, you were not only there as learning, but you were helping educate us from an academic background, because this biomagnetic research is very under researched, and you were contributing, and the doctor was learning from you because you were coming at it from an academic, like you said, classically trained science, where he's Western medicine. And what I compare biomagnetic healing to, Western medicine is the hardware. They treat hardware, your physical issues. This goes into your energy, frequency, energy, and vibration. Nikola Tesla is the universe. And this goes into our software healing. And it also gets into emotional healing, which is a whole other critical a part of the healing process. So you were very contributing to our knowledge. And now you're going and you came home with your magnets, and tell us what you're doing. You're so excited to tell.
Awesome. Thank you so much. So what I'm doing now is I've just been working with as many of my friends that I can see, or their friends of friends. So I've met new people. People have driven up from Moscow, Idaho. And I've worked with just a number of people that have their own personal issues that they're going through, or ailments, or things they're trying to identify. Is it a food condition? And one individual is a 15-year-old with an HPV Gardasil vaccine, and she's needing to detox from that still, and it's 6 months later. So for example, my husband having a chronic back injury, I knew he had a lower back issue, but I didn't know exactly which vertebra and where. And with the magnets, I energetically was able to identify, and he's coming in with his magnifying glass looking to see. So he didn't tell me where or which side. And sure enough, I identified the exact position for him. And my father-in-law has a chronic shoulder injury from surgery last year. The kind where you can tell the person is biting down in pain constantly.
Right.
And so he's a very good sport for me as daughter-in-law. I'm like, just lay down on the bed. Because I didn't have my massage table yet. Lay down on the bed. I'm going to put some magnets all over you. It's going to be fine. He's very open-minded. And I didn't place magnets all over, just targeted some key issues with him because I wanted to go slow with him. And when he sat up, there was this twinkle in his eye. And I looked at him and I was hesitant, but I said, "Jim, you look different. Do you feel good?" And he looked around, and it was like the 1,000-pound monkey was off of his shoulder.
Just like that.
It finally felt better for the first time. Just like that, within that first 15 minutes as he was laying there. But when he sat up, it was obvious. And I also helped target his knee because he was a Vietnam vet. So he's got, a bunch of those kinds of things. Now he's older, and they're all kind of coming out at the same time.
Right.
Right when you're retired and want to enjoy life. And so that one session was on a Monday. I saw him again on Thursday, and I said, "So, how you doing?" And he said that by the way, yesterday, on that Wednesday, I went and played around the golf just to test it out. Not a single issue with my knee or my shoulder. And I'm laughed because I'm like, of course, you're my husband's dad. You're going to test out.
So was it chronic that he had? Was this chronic issues?
Yes, it was chronic. It was left over from, I guess that's where you hold the rifle or whatnot, Vietnam injury, carrying those bags and those packs and,
right.
Being now 70 years old and all of that, and painting and golfing and life. And he still has a little bit of soreness in his shoulder. So I've now seen him a total of 3 sessions, going on our 4th. But he says the pain is maybe 30% of what it was before. He's no longer biting down. Like when you talk to him, he's got a sparkle in his eye, and he's now playing golf again.
Aww.
And he wants to get magnets for himself. So
there
I can help give my hope is that I can help folks based off of Dr. Garcia's training, just, and I want to go back to that in just a second if it's possible, but, he really wants to empower folks to become their own, able to use the biomagnets and the training that we can offer as their own best care at home. So we're not so dependent on the system. And because I had 5 years of going through all of this, and my students had a fundraiser for me so I could get down to Stanford University to the expert on T-cell lymphoma and the other expert on the West Coast in Seattle. And I know about how it is to be a cancer patient or to go from a two-income family all of a sudden having to deal. So my hope is that people will want to get their own magnets. After 2 to 5 sessions, like Dr. Garcia says, you start to see, and I've now witnessed with my 10 pilot friends, you start to see these symptoms fall off that they've been dealing with for a long time.
Right.
And then they can have their own magnets, and they come for a tune-up once a year or a couple times a year, or if they have an issue, we Skype and I help them. And,
Right.
they're not so dependent on that medical system anymore.
Well, it's self-healing
Because
too.
their self-care is
Yeah,
good.
we're self-healing.
Self-care. I like to say, your body is self-healing. I'm not healing you. You're healing your body, and I'm
Right.
just facilitating or guiding it. I'm
Right.
helping your body adjust pH, and then it knows what to do.
How do
And
you
we're
know,
taught that we don't know what to do, but the body does.
how do you know where to place the magnets? When you describe a session, how do you do a session? Like you're going to offer people to do a session with them when they're going to come up to Spokane. So describe how that would go. How would a session with Dr.
So
Ingrid go?
Sure. So what I would need first is their intake consent form and all of that. So any other information of what they might be going through. For example, my father-in-law, he told me I already knew, but his chronic shoulder injury, his knee issues. So I could come in and evaluate any other information he might present to me in the intake, and then make sure I've, re-examined my anatomy, because I have obviously A&P background in anatomy and physiology. So that way I have all my materials out and I'm ready as far as what I think from a biomagnetic pair, the actual pairs that we were taught. And then I have that information so that when I do talk to the person, the next step is any other information they might be going through a divorce or those emotional things that might be happening at the same time. And so that way, when I do have them come for their session, I have some pairs already that I've muscle tested with my own muscle testing on myself. And then in person, I can confirm that. And if we're doing a whole body scan, I will start typically from head to toe with the regions of the body in conjunction with the training that Dr. Garcia gave us. And I just follow that to a T, and the body tells you where to go. And so, for example, with my husband, we started with his lower back. I identified the exact vertebra, the right side of it, the correct side. And that then led to other pairs from muscle testing, which led to a kidney detox. And what was great was his adrenals. He's one of those people who is really stressed out. And so Dr. Garcia said, there's this one pair that I do, and I'll double the pair up. And 9 out of 10 times, if I have to use this pair on this person, they are one of the most stressed out people you will see. So when Jamie, you and I took the class, I was taking notes. Okay, that's my father-in-law. Oh, that's my husband.
Right, me
that's
too.
the gal that I'm going to work on when I get back. When you and I are elbowing each other, going, "Hey, woohoo!" And so, sure enough, I had notes about the stress. And so, with my husband, muscle testing, we went from his areas of issue, and the next thing I knew, I was placing the pairs for that 9 out of 10. This is the most stressed out person. And it wasn't that I said, I want to go do that on my husband. It's that the body led me to that page, which led me to this page. It was mind-boggling.
So what is this? What is the person, or I call them souls? I don't call them patients. I don't like the term patients. Doctors are always practicing. I don't like the word practice. And we have these words that Dr. Garcia is so efficient. He had an attorney come in and tell us what words are forbidden because the American Medical Association mafioso will come after you. And disallowed words are like anti-inflammatory, improve, restore, correct, antibacterial, hormone, sunscreen, diagnose, treat, mitigate, prevent, laxative. All these words we're not allowed to use when we're doing this. But when you're working with somebody, what is muscle testing? How do you know what is the right placement, or how do you know where to place these?
So muscle testing, you gave a great primer to it in one of your previous videos, by the way. So accolades to you for that.
Yeah.
Muscle, that's an intro there that folks could go to. For me, I use the swinging arm method. So that's my self muscle testing when I'm muscle testing questions and I want to use my own body. And I'm going to not be able to pronounce his name properly, but where Dr. Goetz first learned about the biomagnetism was from a seminar at Dr. Richard Brominger from NASA, who was working with the astronauts, and he identified that they have a shortening of their leg length, and he associated it to magnetic energy. And he, in his seminar, explained how he was observing a contraction or shortening in one leg versus the other. And so that's the method that Dr. Garcia showed us in our training, and I follow that method as well. So I do a double muscle testing. I muscle test on myself to confirm, or the opposite, muscle test on the person to confirm, and I'm looking at the leg length shortening. And when my father-in-law or my husband is experiencing a contraction, or I get the correct pair on him, and within about 15 minutes, I recheck, and his leg, the soles of his feet are back aligned. I go, did you notice that? And they just are blown away. That's what I mean about mind-boggling. It really does work.
Yeah, and there's a book called The Art of Muscle Testing, and Dr. Garcia was showing us that you can use your arms, where you put your arms out, and it's all about asking a question to the universe, this universal energy. Can I treat, like when I start a treatment, will I be able to treat this person? And I'll muscle test my thumbs, twiddling my thumbs, and one will get longer, or yes or no. Is this the right magnet placement? Should I use this type of, when we're talking about pairs, we're talking about a positive energy and a negative energy that either push or pull us back into alignment. And you can ask the universe through this muscle testing these questions, and it will come back to you through your physical body, whether it be your one leg getting longer than the other, your arms getting longer than the other, or your thumbs getting longer. And everybody can try this. Like you said, go to my Well Healed YouTube site, and you can see I'm showing you how to muscle test with your thumbs. And that to me is so profound that this is kinesiology, and kinesiologists use this with their arm. They'll put somebody's long arm and they'll raise it and lower it, and it'll get tighter or looser. But this is called hands-on healing that has been done through the ancients. Paracelsus, Franz Anton Mesmer, where mesmerized comes from, used the same magnetic hands-on healing. Like I said, the lodestones, the magnetic lodestones, were used by the ancient Chinese and the Egyptians. So this is ancient teaching knowledge being brought again, and it was homeopathic healing was used until 1910 using biomagnetism. Nikola Tesla had the radionics device. This radionics device was a magnetron, magnet energy, and he was using it to heal people. And they shut it down with a thing called the Flexner Report, Andrew Flexner, in 1910, and basically they banned the AMA from using this type of biomagnetism and called it quackery. Well, it turns out that Mr. Flexner's brother was the president of Rockefeller Foundation, Rockefeller's business. He was the brother of it. So it was a planned execution of biomagnetism to not let us self-heal. And now I'm so grateful and gratitude that we're able to be presenting this to everybody.
Right. And I mean, there's that, but then there's also just, let's apply what we have now and focus on helping people, which is where I'm just off and running right now with the horses, or to the horses. Right. What I've noticed is that I came in, I wanted to prove to myself that this was working, just like when Dr. Garcia transitioned from practicing as an MD writing prescriptions to practicing as a medical doctor, his background, but only using biomagnetism, or biomagnetic air therapy rather. I like that what he did to proof of concept for himself was studying his patients that had UTIs, urinary tract infection. He'd write a prescription, an antibiotic just in case, but he'd still do the biomag pair therapy, and then they'd have the before and after urine sample to verify that they no longer had a UTI. And he explains how time over and over again, they never needed to fill that prescription. And so that was it's not like you're starting out with a deadly disease, let's see. And so from that, when I researched magnetism, historically, like you were just alluding to, mesmerizing and all of that. I wanted to make sure that the muscle testing was working. So I've come into all of this very analytically. When you see the magnet, the single magnet on, and the leg length, almost the separation exacerbates. But when you have the proper pair placed on the body, as you and I were trained, and that's why the training is so important, or working with someone who's certified is really important. Within that 15 minutes, you'll start to see that leg length return to where both of them are aligned, and you know you have the proper placement. So it's not just a hope and a prayer out there and a muscle test. You visually see the leg length resume or return to equivalency, and that's really neat. And then also Dr. Frank, a colleague of Dr. Garcia's, he did that study, you'll remember, in Kenya looking at typhoid fever, right? And they were able to use so this is a peer-reviewed article, and that passed muster in order to be published. You know, I had to go through the NIH and all of that. And the journal, let's see, what journal is it? The
NCBI.
Medical NCBI is like the database, but it was published in the Journal of Medical Acupuncture in 2017. And he studied patients that had typhoid fever that were going to decline. They had the option, but they chose to go with biomagnetic paratherapy first, or only that, as it would end up being, because it worked. And they did a before test, which is called the Widal test, to verify that they had typhoid fever. And then afterwards, they do the same test to verify that it was cleared. And he's a medical doctor, so he could say cured, right? And he was able to cure all of those patients using biomagnetic paratherapy and only biomagnetic paratherapy.
Yeah, and so...
And then Dr. Garcia.
Yeah, I was just going to say that he presented to us. He took Dr. Goy's work and put together this biomagnetic Bible, which is 300 pages with over 300 pairs of placements as he's going. He's showing, because we all have personal issues, and so what I learned a lot from Dr. Garcia is, you know, you may have Lyme disease, but it could be a pathogen, it could be a virus, it could be a fungus, it could be so many different issues, layers on layers on layers, and it could be our outside toxicity, but it could also be emotionally driven. Like when he put me on the table, and I've had leg issues for 5 years, and I got up after he treated me and I ran around the room like I was going to run a marathon. I felt amazing. But what got to it was he found out that I had polio issues, and he saw me gimping because I have a drop foot, and he said, "Oh, I'm going to treat you for polio," and he used me as a class example and put me down on the massage table, and he held my heels and he asked, "Okay, does Jamie have polio?" Yes. Should I treat this polio with this? Yes. So he put a magnet there. Then he went through 4 placements. Then after he was done, does Jamie have any more polio placements? No. So then he said, okay, does Jamie have emotional issues? And he gave us this sheet of, I think, 88 different emotional issues. And then he would scan and say, is it in row A, row B, row C? Yes. Is it an odd number? Yes. Is it 1, 3, 5? Yes. Okay, Jamie, is it number 1? Yes. Repression. Okay, is Jamie repression doing as a result of his polio issues from when he was young? No. Teenager? No. 20, 30, 40, 50s? Yes. 51, 52, 56? Yes. Jamie, what happened 5 years ago? Because I'm 61. What happened 5 years ago with you? And I said, well, my wife left me. And okay, so it was an emotional issue. And I had gotten the polio sugar cube from my mom, and she says, the happiest day of my life is when I gave you the polio sugar cube. Well, I had latent in me the polio issue that got activated from my emotional issues when I was in my in my 50s, and then he cleared that from me. And he says, does Jamie still have work to do emotionally on his issues with his family? Yes. He asked, is it your family? Is it your community? Is it your friends? And it came up family. So we all have emotional issues, and this is what I'm talking about, the software. This is about universal energy healing. The software, where most of medical professions, is the hardware side of it. And the negative is feminine divine. Biomagnetism is negative, pulling energy into the feminine divine healing, pulling us back into optimal health. Because the way I understand this to work, to get homeostasis of perfect balance of our energy frequencies, is that we've been pushed out into an acidic state with all our toxicity, and we need to get back to a more balanced, a neutral of, I think, what is it, pH 7 to 7.3. and that's
Correct.
that's the alkaline state. So we're all trying to eat foods to get more alkaline, less acidic, and all this. This is what does it. And I've got a list here that I'm putting together a spreadsheet of all the different issues. Well, can it treat this? Well, the three most common he is finding: malaria, AIDS, and Lyme disease. It all treats this. I mean, kidney dysfunctions,
And
urinary tract. Go ahead.
right. Well, and like that was what was. Thank you for being so gracious to me. But I really was in the class. I was very much humbled because I didn't want to take the stage from Dr. Garcia, but I knew that his questions that he was getting from some of the people in the class were things that I could explain from the classical chemistry or the quantum mechanics. And so it bridged my background with what he was presenting. And so I really come at this with bringing, well, for example, the feminine and what you're talking about right there. When you place the magnets on the biomagnets, you have the proper pair, and this is what I offer during my sessions. As the person is laying there, there is an effect upon the red blood cells or the erythrocytes within the body. And I think that if you have the proper pair, it really targets it. It's called the rouleau formation or rouleau effect. And in a nutshell, if you have agglutination of those red blood cells, then it's often an indicator of what we see on the macro manifest as disease states. And that's attributed to the inflammation and the pH imbalances. And so the magnets actually target that, which is, so what I like to explain to my friends or clients is, if you could take the string from that crochet blanket and pull it and unravel it, that's what the magnets do. And I think for me, I'm going to hand wave here, I speculate that as that process is happening, is within the bloodstream of the individual, it allows for that emotional release if they are open. And I've seen that now consistently with all 10 out of 10 people, 9 out of 10, because I didn't want to do the emotional stuff with my father-in-law out of respect for him.
Absolutely.
But so when you see under the microscope how the magnets affect magnetized versus unmagnetized blood, and as the person in front of you starts to have an emotional release, I believe it's somehow connected to that. So it's not just wishy-washy, they're having an emotional release. Well, no, there's an underlying physiological effect. That proper biomagnetic pair placement allows the body to relax and have that energy flow through.
Yeah, once we reach that balanced homeostatic state, the parasites, bacteria, funguses, and viruses, they can't live in this ultimate homeostatic state. And so these cells are broken up at such a micro, and this is your world. I shouldn't be telling this to you, but once that's broken up at that state, yeah, go ahead.
They go through what's called transmutation. So essentially the placement of the magnets in the right location, it targets micro compartments or micro sites within the body. And based off of Dr. Goa's 30 years of annotating associations, he's been able to identify certain conditions that tend to relate to certain placements of the magnets on the body. And so that's why you and I are able to run and jump in so well doing this work right now. And so that's kind of where I go from with my client sessions. And if they are open to the emotional, we'll go there. If they're not, then I don't want to push that. But during my hour and a half to 3 hours, I'm downloading all the best of everything that I have from my dietitian teaching expertise, from the chemistry, from being a patient, or from being in the white lab coat side of things. So I can really give all of myself to the people I'm working with. And hopefully, if they're open, we'll go there, because I think to that emotional stuff that you're talking about.
Right. And it's like Dr. Garcia says, laser focus. And we're the conduits for this healing to help people facilitate, the souls facilitate their own healing. And what I'm very excited too is like you said, the person that's doing the treatment have to be open to this. If they have an energy block about, oh, this is ridiculous, this is woo woo and all this, it's not going to work. So if you're not open to this type of healing, then it's likely not going to be the right thing for you. Is that correct?
Correct. And I have a good visual analogy. That's how I like to teach, is with analogies or Socratic method, get my students involved. So if you think about throwing a rock into a lake and you want to see it skip and have those ripples, if you were to put a wall or some big brick wall or something in front of that, those ripples will not be able to pass through as well. Now that gets into quantum interference at the down minuscule level, but just the point of being open or closed off, that's just a good visual that I like to use, and
Right.
that the magnets help to unravel that crochet blanket, or if you think those onion layers, peeling them back, and it's the chemicals, the toxins, all that garbage, the toxins, that the organisms, the microbes release in your body, that for me is like the glue for those pieces of onions that peel, that need to be peeled off. And so as you're doing these sessions, that's why it's usually 2 to 5 sessions, like Dr. Garcia says, or 5 to 10 for more major conditions, I guess, because there's a lot of those underlying peeling of onions that need to, of layers of the onion, and then the glue, the detox material that needs to be flushed out of the system.
Right.
So it's so important to help people, your clients, to be aware of what they can choose should they go to a health food store or Amazon to get for themselves to help that process. And that's, you can find a lot of that information online. And then I'm a bouncing board for those kinds of things like chelating and your diet and chlorella and all that sort of stuff.
Right, and that's the other part of it too. Is it's not just, oh, treatment, I feel better, thank you, doctor. It's you've got to make a lifestyle change, whether it be what you intake with your nutrition or how you're stressed out or whatever, because there's issues that caused it, and it'll come back again if you don't change your lifestyle too. So it has to be a proactive type of interchange with whoever is working with you. And the other thing too is that this covers just basically every malady, whether it's emotional, physical, spiritual, cancer, multiple sclerosis, TB, vaccine and, injuries,
Correct.
common cold, flu, sleep.
With things like Lyme's or with cancers or MS, for example, the analogy that I have from my synthesis of all of the material and my background is, again, a visual. If you think of an x-axis and a y-axis, and then you have your Z1 and Z2. So everything possibly you may have been exposed to that's a pathogen or toxic to your body can leave a fingerprint, if you will, that's an x-axis, and then exposure to something else, that's the y-axis. And so the perfect cacophony of all of these energetic disruptions in your body, wherever that crossing point is that they intersect, can then manifest as, oh, look, you have prostate cancer. And so for me, energetically, with the biomagnetic paratraining, I'm peeling back the x-axis, the y-axis. I'm pulling at the string for that crochet rag, a blanket, as opposed to throwing drugs at it and cutting it and radiation to burn it.
Cut, burn, slash, take a pill, right?
Slash, burn, and poison. No. And that's as a cancer. That's why I think my background really helps a lot, because I came in classically trained, but I also had 5 years as a tortured biomedical patient, understanding what it's like to have a bone marrow biopsy without sedation, or to take 3 months of chemo once a week, and they tell you you're going to need to do this for the rest of your life. And yet on the side of the bottle, it says may cause liver cirrhosis and pulmonary fibroids. I mean, what's next? Anal leakage for life?
Yeah, right. And chemo causes cancer, it's proven. Yeah.
Right. And then they wanted me to try topical when I had such a bad reaction to the chemotherapy. I mean, who doesn't, right? But I mean, to the point of almost killing me. And this is supposed to be an incurable cancer. The next option was topical nitrogen mustard. I'm like, oh, you got some extra mustard gas left over somewhere, huh?
Just like they used the waste product of fluoride to put into our water, because it was a waste product of alcohol,
we have
aluminum.
This waste. What can we use for it now?
How can we monetize it?
To people.
Exactly. And just also the terminology. Go ahead. Well, I was just going to say the terminology, like at pharmacy, the root word of pharmacy is harm. The root word of pill is ill. When you go into surgery, surge, that's electrical power. They start you with paddles, defibrillators to start your heart back up, electric. So this is all energy
Right.
healing is all connected. They just don't teach this spiritual
Correct.
science to us until
Well,
now.
what's interesting though, I mean, because let's just keep it positive. They're now teaching this in the medical schools in Spain.
Right.
I mean, so it is becoming part of the maybe not mainstream, but it's starting to get at least recognition because now we have these peer-reviewed publications demonstrating its efficacy. And to be honest, Dr. Frank had to publish it and calling this. He didn't call it medicine. He called it first aid.
There you go.
So I think that's interesting. Yeah. So
tell us how. Let's say I've listened to this. I said, Dr. Ingrid, I live in nearby, and I want to come and have you do a treatment on me, and you're offering at a discounted rate right now. So how do they get in
Correct.
touch with you?
So my email address is Dr. Ingrid PHD, and I'm sure you're going to have that up. So at gmail.com. And so just send me an email, and then we can start the conversation that way. And if people can travel to me, I'm here, and I just want to help people. I want to change the conversation. And I want to work with those folks also that, they're not necessarily willing to give up the Western allopathic medicine, but they want to try something in the meantime while they're in the staging process, or let's give it a shot before we try that other drug that's going to be something I have to take for life or whatnot. So that it's my vision is that we can bridge the gap as opposed to keeping it separate from the other white lab coat folks. And I do wear my white lab coat because I'm working with tape.
Oh, okay.
And so I take it off of my lab coat as opposed to like filling out my clothes,
So what about children and elderly? Would you be willing to have a session with them?
Oh, absolutely. And I mean, Dr. Garcia has trained us on how to work with younger kids. And, in those situations, oftentimes having their parent, or if it's energetically, you can tell energetically that it's a good relationship. My niece has Down syndrome, and she's 6 years old, and she's going to be coming up, and I'm going to be working with her and my sister-in-law so that if my sister-in-law wants to place the magnets, that way she can do it since the little kiddo can't do it, obviously.
Wonderful.
I just worked with a 15-year-old HPV vaccine injured gal. And it's just, those more acute aches and ailments, or like, for example, my husband, he worked out really hard and he should have been hobbling the next day. I know him. He's 40, I placed the pairs on him. He had, what do you get after working out? Buildup of lactic acid. What do the magnets target? The protons to reduce that acidity. The next day, he was running around with the kids, no soreness at all.
So
Remarkable.
sports medicine, this is a whole other field in sports
medicine, recovery from Ironman. So I'm thinking about having a booth at Ironman, helping out, going, this is what you guys need. Or
right.
Ladies as well.
and Dr. Garcia, and then we should probably wrap this up, but Dr. Garcia told this wonderful story about his wife's father who got run over by a car and had a gash in his head that he could actually see the skull.
It could have been a TBI.
What does TBI mean?
It in very well many reasons it ought to have been a traumatic brain injury that I believe from his presentation of the material and all the evidence that he documented and showed us. So I'm coming from that medical standpoint, interpreting it. He definitely mitigated what could have been a very bad traumatic brain injury. So I think
can
the
you imagine
future of
that?
biomagnetism.
Yeah, well, just imagine that. Here's the guy bleeding from his head. It's his wife's father, and
see the skull. You can see his skull.
You can see his skull, and everybody wants to rush him to the emergency room, right? And he said, "No,
right.
I want to treat him with magnets." And his wife, it's her father, who's had his traumatic brain injury sitting right there, said, "Go for it." And he shows the pictures. He has it in his book shows the pictures of 1 day, 3 day. He removed the pain, he removed the swelling, and then he removed the inflammation. And then within 3 days, the wound started to heal and close. And what was it, like in 2 months, you could hardly even see the scar anymore? Something like that?
Correct.
And you could not,
Correct.
and he never went to the emergency room.
Right. And then, or 1988, Dr. Go is his first patient, because he's an MD and Dr. Garcia is an MD. So
right.
for them to say we're going to treat like this is one thing, but or the original patient, that doctor, because he can say patient because Dr. Goes is a medical doctor, he worked on in his clinic in Mexico, was a HIV positive man who still lives today HIV negative after one session.
And that's what got him started, right?
That's what got him started. Yeah.
Wow.
So this is just an amazing thing that has been just not covered in the United States, but we're hoping to empower people and inform them, and people can then start to have their own, let's call it first aid, biomagnetic pair first aid at home.
Yeah. And
And
if
they can
you
have guides and facilitators to help them along the way.
and if you go to the website, Dr. Garcia's website is usbiomag.com, usbiomag.com. You can order magnets from there. He has two training sessions coming up. One is in New Jersey in November, and the other I'm very honored to be hosting out here in California, Northern California, in Mendocino County, October 23rd to the 27th. And anyone that finds this interesting, anybody can do this, folks. I'm a finance guy. I'm totally left brain, and I got into this, and I was seeing results. So, if you can, we're going to be putting it up on my website, wellhealed.life, or email me at jwlpeace@gmail.com, or email Ingrid as well. She's got the Dr. Ingrid. She's got the information. But please,
Dr. Ingrid PHD at
Dr.
Gmail.
Ingrid
But I think it's
PhD at
important
email.
to add, I think it's really important to add for folks, like, you may have the most flipped out titration glassware tool, but if you don't know how to use it and do a proper titration, you can hurt yourself. And so it's very important that people either take the training or they work with a guide or facilitator such as you or myself or whomever, and so that they have proper placement, because you don't want to think that you're helping somebody and then you do something wrong. And so that's why it's important to be certified, I think, if you're going to be a practitioner.
No, totally. And that's you got to learn the protocol of what the placements do, where to place
Correct.
them,
And
and
it's not that it would hurt. It's not that it would hurt somebody, because there is no evidence of it being harmful. It's just what is so wonderful about energy work. It's just you want it to be effective.
right. You're not, and this is why before I do a muscle test, I say, is this person open to me treating them? And if I get a yes, I will treat them. But if I get a no, I'm saying, I'm sorry, because I went to my father, who's been a medical urologist for 30 years, and his wife, who's been a registered nurse for 30 years. And I brought out my book and I bought my magnets at the breakfast table the other day. And I'm going, well, let's see how this goes. And I did a thumb test before I went in. I said, will my dad be open to this? And I got a yes. And I did a thumb test about his wife, and I said, would she be open? And I got a no. She just had cancer surgery. She just had back surgery. And she's very kind of like, Western medicine, this stuff works. And so I went in, and after showing him the book and showing the treatments, my dad says, well, I have issues with, he's 92 years old, with balance. I said, well, here, put the magnets
Oh,
on each side of your forehead and stuff. And he put it on for 15 minutes, and it was so cool to see my medical father looking at me, who has no medical background whatsoever, and saying, I'm going to try this. I'm open to this.
hmm
And then his wife said, well, can you help me? I can't sleep through the night. I said, well, I don't think I'm the right person to be able to do this. But here in the book, it says, if you place these magnets here and here and here for sleep, then maybe that will help you. And so instead of me making it my treating her, she is self-treating. And then she called me the next day. She goes, Jamie, I slept through the night. Same thing with my 91-year-old mother. I hadn't slept through
oh,
the night in months. I gave her the treatments, and she slept through the night. It works, folks. It really does. It
right.
really
I know
does.
one of my clients, she hasn't had sensation in her hand in 12 or 20 years. And after her second session with me, she's laying her hands and waving them in the air. And she's like crying because she feels a draft on her hands for the first time, first sense of
Oh,
sensation.
wonderful.
Yeah. And so I thought teaching is rewarding, but this is just amazing.
Healing. We're in the healing business. Well healed. Well, Dr. Ingrid, thank you so much. Dr. Ingrid PhD at gmail.com. Book a session with her, folks. It'll be an hour and a half to 3 hours, and it's a full scan, folks. She'll go into everything. She's got both sides of the coin going now, and she's one of the only unique ones that has the academic and now the not practicing, but the facilitating side to help self heal. So, get in touch with her. If you can't, just contact me, and I'll get in touch with her through me to her. But is there anything you'd like to add, Doctor, as a final here?
I just want to thank you, Jamie, and I also want to thank Dr. Garcia, and just also a shout out to your dear good friend, because gratitude, we need more of that on the planet, and gratitude to Stephen Ferguson, who drove us around in New York.
Oh
If
yeah,
you're
that was
listening,
fun.
thank
Yeah, yeah.
you.
Thank you, Stephen.
That was a blast.
Yeah, we got to see New York.
Yep.
All right, well, onward towards health and healing, and let the healing begin, and let it begin with us, right?
I love it. I love that mantra. All right, take care. Thank you.
Thank you, Dr. Ingrid. We'll be in touch. Bye.
Thanks. Thanks. Bye.